Hi, this is Dr. Odell, Back to Health. Today we're going to talk about why we're different. Let's start with what we know. We know that the brain and the nervous system control every muscle, organ, tissue, cell function in the body. We know when we have stress in our environment, that can be physical, chemical, or emotional. We get these neural structural shifts. These are like circuit breakers. We've got like the brain and the brainal cord circuit breakers that can not only cause pain and dysfunction, which brings a lot of people here in the first place, but can affect every organ system in the body. When we have those shifts, that's part one. Part two, we look at how those shifts are affecting the information back to the brain and how you're processing, engaging, and functioning in your world. The first question with number one, with the neural structural shifts or subluxations, we evaluate that by looking at things like tone, muscle tone, enthesiopathy or pain in the spine, range of motion, posture is a really big one. We look at heart rate variability, which looks at the overall stress imbalance of the nervous system, fight or flight, rest, digest. We also look at, we do a thermal scan, so we're looking at the part of the nerves that control the organs. The next step for question two, which makes us different here, is evaluating how that information or change in information or static in the system is now affecting the way we process our world. With the kiddos, we look along the trajectory of brain development, starting with infantile motor reflexes, motor touch, audio-verbal, and then visualization, big brain, cognition stuff. Some of our adult patients with like TBIs or severe neurodegenerative diseases, we also look at things through that lens. But we also look at things like vestibular, cerebellar, eye movement patterns, sensory and motor mapping. What those do is those are windows in the brain, so we can sleuth and find parts of the brain that are weak per side, and we tailor our treatments based on that part of the brain. We do that through, of course, adjustments like other chiropractors, although we are very specific, looking for changes in neurologic outcome. We have lasers that we use a lot to stimulate brain-derived neurotrophic factor so that it speeds up the process of this neuroplasticity and the change in the system. Anyway, that's kind of how we approach things here. There's much more, but I wanted to keep this short and simple. If you have any questions, please give us a call at Back to Health. Look forward to seeing you.